mandibular fractures. See this case, you can see this radiolucency and infection in that region. Huh? What you should treat that infection immediately, or if it is not repellable, you cut this implant and take it out. If you neglect it again, what happens? It can cause fracture. But more than this, infection and fracture, mostly what happens is interforaminal. Those before Alan 4, people used to place 5 to 6 implants only in interforaminal region. So sometimes, now I say 5 implants in interforaminal region you can place and you can give a up to first molar cantilever. This I said, but it is not possible to do that 5 implants in all the cases. That depends upon the perimeter of the mandible. If the lady or young, maybe the very small jaw, perimeter is small, and in that you are trying to incorporate 5 implants interforaminal, that too very very close, to avoid the nerve damage, to avoid the anterior loop. What happens? Only rods, no concrete. Does it work? Any building structure, you need to have a proper rods and proper concrete. So this mandible is there, where there is no bone, the only implants are there. You had promised for 5 implants to the patient and एक कम डालेगा तो एक कम पैसा मिलेगा. 5 implants promised, placed 5 implants. And to avoid risk, you have placed all closer. पीछे जाएगा तो nerve damage. All closer. Then till now patient was not biting, everything fine. Even though bone was thin, okay. But you have placed 5 implants, suddenly given a prosthesis and the patient is biting now. It can cause fracture. Implant, mandibular fracture. Like this. कहाँ कौन रहेगा उसमें? हाँ? Placed so closely. Huh? Okay. No use. I said, do whatever you want and nothing will happen. Huh? This can happen. Huh? Perforating anything is fine. But if you are losing implant into the sinus, sometimes you can retrieve, okay? You can do a lateral window, and you can ask the patient to breathe out, use high suction. Sometimes you are lucky enough, implant will come out. But sometimes it won't come that easily. Maxillary sinus is not a round ball or a smooth surface as rectangle. It is irregular. Posterior angle is there, anterior, okay, beyond the orbit, many places. In anterior wall, if it is there, you can put any instrument and do whatever you want because it is your area. But suppose the posterior triangular, which is below the orbit, orbital floor is also very thin bone. You cannot play there. Okay. So, if at all implant gets displaced into the maxillary sinus, if it is possible to remove, means you are creating a window. If you are able to retrieve it. But if it is in a beyond reachable area, means sometimes what happens is implant gets sucked in inside and it stays in some unreachable position. It doesn't move. Suppose if it's moving, then you can somehow catch it. But implant got stuck. Over there is a fibrous tissue formation. Connective tissue has grown. Why to remove? Okay. It is like if the patient is informed, no problem. Without information, you cannot just leave it. Okay? So I have some 3 to 4 cases where I tried because in one case it was not retrievable. In one case, patient had gone to US and he came after a long time. It was with one oral surgeon only, one of my colleagues. So I had placed implants there, 3 implants. One of the implant got inside, and patient came off from US after 3 months. So in that, implant had gone inside. So I told him, take X-ray after a month again. So both the X-rays are matching. Implant is not moving. I said no need to touch. Just inform, no problem. Okay? Because when the other implants are there in that position, creating a window, you will disturb these implants also. And in one case, there was already an implant in the 6th region and I was trying to retrieve from the 7th region. So this implant was interfering. So I couldn't retrieve. So one more case is this Deccan Dental Depot case, just nearby. So like these 3 to 4 cases where implant is there, patient is fine, everything is fine, nothing has happened. So if at all it gets displaced also, no need to worry. Somehow if you want to remove, you can remove. But if at all it can be removed and in your dental chair only, if you are confident of opening a lateral window, you do on yourself. Or else if you can call your friend, do. Means only with your dental management. There is see, if you want a better help, on Amazon you get a camera, endoscopy type, 2009. I have that, a thin. You can put that camera and mobile app, you can see where the implant is. Okay? So if it can be managed on our dental chair, it doesn't be a big problem. Suppose you took opinion of a ENT surgeon. You took patient to a ENT surgeon. What happens then? ENT surgeon will definitely create, oh, we have to remove this. Then admitting it into the operation theatre, removing that implant and everything will become a big story for the patients also. Everyone's practice is limited to that particular region. ऐसा नहीं कि you are practicing and patients are coming from 100 kilometers. दूर दूर तक कोई डेंटिस्ट नहीं है. ऐसा नहीं है. Okay, so that bad mouth can happen. So if it, our own team, our own on the clinic. So one day what happened? My friend, that implant, what happened is, while removing the cover screw, implant was in the, see, when you are removing the cover screw in the maxillary posteriors, if it was indirect sinus tip, patient indirect sinus tip was done. So there is no resistance from the top. Cover screw touch and anti-clockwise, always down motion. इसको ऐसे touch करके okay. So 2 of my implant which we left in the sinus is because of these procedures while removing the cover screw, and that too of indirect sinus lift cases. You know, right? Normally this is a sinus floor. This is a sinus floor, and you place implant here. You do anything to this, this won't go. You do apply pressure, it won't go inside the sinus. But suppose if it was an indirect sinus tip, what happens? Implant is extending into this region. There is no floor now. There is no floor on that. You have placed the graft, but graft will not form so soon. It will take a lot of time. And you have thought of doing now cover screw removal. Huh? So suppose if the loose trabecular pattern, and sometimes you will not feel that, no? Okay? So once it has happened with one of the participants, we do, right, prosthetic cases, do the prosthetics for the patients. So after that we are avoiding to do the stage 2 procedures for the indirect sinus lift cases with the new beginners, because everything went well, everything was fine. Only in trying to remove the cover screw, implant marks. Okay. So even if it goes inside, try to remove it. Don't make it. वो medical side नहीं जाने देना. Okay. If we are able to manage with your oral surgeon friends, or else even if it can be left in the sinus, no problem at all. Yes, yes. Okay. So 4 implants अभी हमारे sinus में है.
No, probably there like an elbow lip, na?
But the surrounding graduation tissue will
हो जाएगा उसपे. हाँ. Implant is not moving means fine, but every month implant changing will तो फिर उसको नहीं. Because it will moving implant will cause inflammation there. Then patient will have frequent sinusitis. That you have to remove. और फिर कितना भी बड़ा window करके more aggressive, इतना छोटा window, you will create a bigger window and somehow you can retrieve. You can see with the camera and everything. So why to damage unnecessarily creating window? If it is stable at one point, it is a sterile implant. The sterile implant, already you see, now you talk about the zygomatic implants and the other implants. 10 mm implant, 15 mm implant is in the sinus. What's happening? Nothing, right? Implant, earlier now we are doing implants extra sinus. But earlier zygomatic implants used to be intrasinus. Through the sinus and attaching the zygomatic bone. Around 15-20 mm implant is in the sinus. What's happening? Nothing. Because it is stable and sterile. So if it is stable and sterile,
What about the
fine.
healing screw, sir? The cover, it has gone inside with implant. That one becomes a
Sometimes healing cap, because it was exposed to the external environment, it can create infection. But again, you observe it. If it is not, then fine. But it can create problem, as you say, if it gone with the healing cap. But usually healing cap placed means healing collar is always wider than the implant diameter. We sometimes deliberately place healing collars at so that implant should not go. After indirect sinus lift and all, healing cups so that it is wider. कुछ होगा भी तो it won't go. Okay. So usually with healing caps, implant won't go because it is wide. It won't go that easily.